live, I brought in the butt doctor again, okay? He has this awesome package where you can get your butt done. And now, mind you, doctor, when a person gets their butt done, they don't have to go all Nicki Minaj or
I know.
J-Lo, or you can get just like a nicer, a little bit bigger butt.
That's right.
A little bit.
Yeah, we've got a lot of discretion on what we do. And what we really like is round from both directions. You want to be round from the side, okay, and you want to be round from the back. So you want a round full bottom both directions. And my personal preference, and sometimes we go around it, but what I prefer is to make that proportional to where your body is. So
Right.
it looks good, it looks sexy, but it doesn't look like you've had anything done.
Right. See, sometimes you'll see a woman with surgery and it look like whoop whoop, like an egg on legs or a tomato
Or
on
you'll
toothpick.
see them be too tall, or you'll see them be too short. You know, it's all about shaping it for you.
Right.
And that requires a lot of experience. We've done about 500 of these, so we've done quite a few of them.
Now, when I came in to get my consultation with you, I'm going to share with Facebook. Tell everybody what kind of butt you said I have.
Well, yeah, you had what we've referred to as a cliff butt. It's also referred to commonly as a V-shaped butt because you're a little bit wider at the top than you are here at the bottom.
Why is it a cliff?
Because you've got this, and you've lost some weight. Since
Yeah,
I
you
did
told me
that.
to. You told me I was fat.
I told you need to lose some weight. Okay, but you've got a little shelf right here.
Hey,
that's part of what we're doing with this package. So we'll come in and we'll shave this shelf off, which by itself already is going to give you a nicer look. It's already going to make it look rounder the way we want before we even put any fat in. Okay, so we take this off right here. That's part of the package. And then we add the fat back in through here, so we round it off this way too.
So my cliff is like I got this, but then it goes,
Correct.
and then it just
fall
off. Just fall off.
That's right. So we trim off some of the cliff, and then we fill in all through here to make it round from the top from side to side, and round this way as well when we look at it from the back.
Wow. Now, how many different butt shapes are there? Like I'm a cliff. What are the
Well, you also see a lot of folks that are just narrow. Okay,
like straight up and down.
Just straight up and down.
Okay.
And we see real commonly folks that will have a normal type of top, and then a real flat in the middle, and then a normal bottom.
Like kind of.
So they're just flat.
Wow. Okay.
And for those, you like to make sure that you round out that flat spot. And if you go to make them as big as you can, the problem with that is that skin will flatten back out in the middle again.
Okay.
So on those folks, it's all about the shape.
Right. Okay. Yeah, because I'm serious about this. Now, I'm just going to let people know I've been happy with my cliff butt for quite a few years. So I'm not getting this done to make me be accepted. I'm getting it done because I'm getting a little older. Things are getting a little droopy, and I want the kind of butt that when you see that you were to put a sundress on, you'd be like, damn girl. I don't want like, oh shit. No, I want a damn girl. You've been working out, that kind of butt.
Right.
You know what I'm saying?
I do know what you're saying, and those are the ones that I think look the very best.
Yes.
Because they look nice. They draw attention in the way you want to draw attention. Okay?
Yeah.
People say, boy, she looks good in that dress.
Right.
Has she lost weight? Or, wow, she's been working out.
Right.
Rather than, wow, what surgeon did she see?
Right. Hello. There's a difference.
So, yeah, and we can do it the other way. I've done many of them the other way. I've had patients that you have to watch and make sure the door doesn't hit them on their way out of the room.
Oh, no, he didn't.
Okay. But those are ones that you want to make really certain that the patient really wants that.
Right.
Because it's going to be obvious to everyone that sees them.
White out,
that they've had something.
How
done.
you like me now?
Yeah, exactly.
Now, the deal you're offering right now is $4,000 to take this and this off.
That's right.
And put it
and from about right here all the way around. Okay, and we take all that out and shape the top of the buttocks, and then we take that fat and put it in where we need it down below.
And you shape it. You don't just stick it in. You shape it.
Oh no, it's all about the shape.
Yeah, it's not just about the stick.
And it's not about the size so much as the shape for most women.
That's what I'm saying.
I think a lot of women get real hung up on the size when the shape is what really makes it a really sexy. You want that inverted heart where you've got that heart-shaped look on the bottom.
Right. And then I want every man's heart to go like this when they see it.
It's the same thing.
And then I want my butt to do that when okay, never mind. Now, also, not to get away from the butt, you're offering the same fat transfer surgery for the breast.
Well, and for that, we're taking the fat from the stomach. So if we take it from the lower part of your stomach or the upper part of your stomach, either one, and we move that fat to your breast, then we're charging that same $4,000 price.
Now, you say when you move, now, and I'm going to be honest, when I was getting dressed, I have noticed my breasts are not where they used to be. You know what I'm saying? Like I used to not wear a bra ever. Like I was part of the itty bitty titty committee. Then I had Dylan, and when I was pregnant with Dylan, oh my God, my thing set up. Like I used to pray to God, like, please, I'll never smoke, I'll never drink Patron. Just let these things stay where they were, because even if I didn't have a bra on, they were right there, and they were gorgeous. They were full of lactating. I was the best thing ever. Had Dylan, and they eventually just kind of, and they're not like Africa titties, but they're like Asia. I don't know. They're halfway there. So if I were to get the fat in my titties, would they sit up?
Yeah, we'll get them back up. One of the best ways to think about it, a lot of women that have breastfed, when we first do the fat transfer and we have plenty of fat, we'll have their breasts looking very much like they did when they were breastfeeding.
Oh, wait a minute. Did you hear that? That is like...
Now, some of that fullness is going to go away over time. We'll get a little more natural, non-pregnant look over time.
Right.
But that's the best example of what I can give most women. And the advantage of fat is they don't look like melons.
That's what I was about to say. When you're watching like the red carpet and you see stars that have the fake it's like two things sitting here with a flat chest, like two objects, like two foreign objects sitting there, and it don't look natural. Even when they do this, it don't look natural.
And that's why fat transfers to the breast is one of the fastest growing cosmetic procedures.
And you got that on the logo.
It looks so natural, and a lot of folks are combining it with their implants now to avoid that exact look you're talking about.
Looking like this. Yeah.
Looking like you've got a floating ball on top of your
exactly,
ribcage.
like two basketballs. Yeah. It's the grossest thing. I think it's the grossest thing ever to see. And I literally was wondering how I could get my breasts perky without putting something in them.
Well, you're putting your own fat.
Yeah, well, I meant like putting
there's no reaction, and it feels completely natural when you're done.
Wow, thank God for push-up bras, baby, because these things I'm like, so they'll be looking like this once I get my surgery done. Now, last time I saw Dr. Johnson, he gave me a consultation, and he said I needed to lose like 15, 20
about
pounds?
15 to 20 pounds.
Now, explain to someone, now, why would a person need to lose weight in order to get lipo done? And I'm going to let him show you how mine is.
There's a difference between the lipo and the fat transfer.
Right.
Okay. But with the lipo, we could do you right now and we'd have a nice result. Okay. And you're right at what we can get really pretty flat without having to do a tummy tuck or make a big incision. Okay. We can get this.
Last time I was there, he said I needed a tummy tuck.
Yeah. That shows the weight loss.
Yeah.
Because your skin is rebounded nicely, and I think we can lipo this and use the smart lipo, and you're going to be pretty flat and tight, and you're going to be real happy here in front. Okay. Now, but here's the thing. If we did it at this weight and got your butt perfect with the fat transfer, and then you lost 15 to 20 pounds, a lot of that's going to come out of your bottom.
Okay.
And we won't have that look that we're going to finish with when we do it.
Right.
Okay.
And what you was talking about with me, I had like this poked out a lot here.
Yeah, it was pretty predominant.
And it's called visceral fat.
Visceral fat. So what was up here now is all fat under the skin. What you have now is all stuff I can go get with the liposuction.
But before, so if you have
your muscle was out here, and I can still get what's on top, but it's not going to make you flat because so much fat is inside the muscle that even if I get rid of everything that's on top of the muscle, you're still going to have fat inside the muscle that makes it curve outward.
Right, that's what you told me.
And your weight loss has done a great job on getting rid of the visceral fat.
No, he's a motivator, y'all. Imagine going to get lipo and he's telling me, well, you're too big for lipo. And I was like, and that's the last time I saw him, and I was like, okay, well, I gotta, because I want, now, and then again, I say, I'm happy with my body, but I'm old enough that I would not suggest this for a 16-year-old, because you need to be happy. You need to be happy. And if you're happy with your body, then do things that you want to, like, enhance.
Well, you've also had what so many women have, and that is the body that you have now has been influenced by pregnancy.
Dylan.
Been influenced by hormonal changes.
Right.
And by age.
Yeah.
And you've been happy always.
Yeah.
You were happy when you were 20,
right.
But you don't have the body you had when you were 20.
Hell no.
Okay.
No, I don't.
And so what we can do, because you can't select where that fat leaves, you're at the mercy of your genetics.
Right.
What we can do is take the fat where you don't want it here or here.
In that back.
And in the back, and we can put it in your buttocks where you you'd like it, or in your breast where you'd like it.
Right.
And make it work for you and not against you.
Right. And I can't stress this more than enough, because I've been to Dr. Johnson, and you are a person that's about the quality of work. You have a high quality, a quality of work, and for you to come down on your prices like that is pretty effing amazing.
Well, what it really is a reflection of the amount of work. When I'm able to do the breast fat transfer from your stomach, that's really saves me work. Okay? If I tried to do that from your arms, I can. And we do a lot of fat transfer from the arms, but I can't cut the price down on that one because arms is a lot more work for me.
Right, like when you got that jiggy thing.
Right, and I've got to spend a lot of time to tighten this up, a lot more time it takes on the stomach.
Right.
And I've got to turn you quite a bit to do the arms, where when I've got you laying flat in your back, it's easy and quick for me.
That's what he said last night.
So what we're able to do, don't talk to my wife. What we're able to do is give that savings that I have in time and work into a lower price for our patients.
I appreciate that. Now you see Facebook Live. I'm about to make my appointment. Doctor, when can I come in?
Just call Soot. She's the one that keeps the appointment booked.
Now, seriously, how long is this deal going to last? Because I don't want somebody to be sitting here thinking that they got a year to come in there.
Well, we're going to try it out for about 6 weeks and see what kind of response we get.
Okay.
We like the package. We like the idea. But the advantage for the patients is as long as they stick with the package, they've got a really nice price.
Right.
The disadvantage is it's the package.
Right.
Okay.
So the package is love handles and upper back for the butt. Lower back. So the thing that we hate right here, this that we do not like, goes here.
Correct.
And you get this, or this and this for here.
Correct.
And these are places that we want gone.
Right.
And put them in a nice
we package it with areas that you'd like to do.
You already want.
But at the same time, with the reason the package works at the lower price is it's lowered my workload and the time it takes me to do it.
Okay.
So I can take that and do another case, or do other things, and because it's easier on me and it's faster for us, we can allow that to be a lower price for our patients.
One more question: when you do the butts, put the fat in the butt, do I have to sleep on my? I heard that you can't sit down for 3 weeks, after you get your butt surgery.
This is one of the most common questions. And you get controversy among this even when you talk to doctors.
Okay.
Okay? And the answer I get from the very best people, the people that I really trust, is that no, it doesn't matter much. One reason is when we're sitting, we always shift around. We always move fairly constantly.
Right.
And the reason for that is it helps distribute the load evenly and helps our bodies keep from damaging the tissue.
Okay.
We're still doing that when we put fat back there.
Okay.
But the other reason, the biggest reason is, look at where you're sitting. We're putting the fat here, okay? You're sitting on this bone right here. So when you're sitting down, you're not sitting on where we put the fat.
Oh, because you're putting the fat. Okay.
Because we're putting the fat here where you need it to make you round and full.
Okay.
You don't need it right here where you're sitting.
So after you say after I get the surgery, when will I be able to sit?
The next day. Or that night, for that matter.
Really?
Yeah, we don't put any restrictions on sitting.
So why would some people say you can't a whole week? You can't.
It is there, and there are a lot of doctors that say that, and I think it's just a failure to really understand what's going on when we sit. It's a failure to understand how frequently we move to adjust ourselves and to help, and it's a failure to understand where the fat's going when we put it in for fat transfer, and what part of the buttock we're sitting on.
Right.
Because we really don't put any fat to speak of down where you're actually sitting.
Right.
Okay. So if you sat like this, then yeah, there might be a problem.
Right.
But most of us sit like this.
Right. Okay.
And you're not sitting on where we put the fat.
And you've never did a fat transfer surgery where somebody came back and said, "I done sat my ass flat again."
I have never had that happen. And like I said, we've done over 500.
Yeah. Okay. Man. Well, I'm informed. I'm informed. This, all of it. I mean, I'm just so happy that you have these hot new prices. I really am.
Yeah, I think it's going to be a great package for our patients. I
do. I am too. So the number is 214-346-8667.
That's it.
I know it because I used to call it every day. They thought I was stalking. And then the website, and you all are on
we're on Facebook.
Facebook, Innovations Medical, Facebook, innovationsmedical.com. And you can see some of the Brazilian.
You can see some results.
Yeah.
And learn more about the procedures.
Yeah. And do you have more about the pricing on there too, about the
we
packages?
don't have pricing on the website, but they can call and get all the pricing information they need.
Get all the pricing information and to make that free consultation
That's right.
at 214-346-8667. Well, I hope you learned something today, Facebook Live. And next time you see me on Facebook Live, I might have a bigger butt. No, not a nicer butt.
There you go.
Yeah, a nice, woo, girl, you been working out kind of butt. Yeah, that's what I'm going for. See y'all. Make sure you check him out.
Bye-bye.
Dr. Bill Johnson. All right?